Today our topic is the ovaries. The female gonads are called the ovaries. In this article, we will initially look at the basic function, location, components and the clinical significance of the ovaries. The later part of the article will cover the ligaments associated with the ovaries and their vasculature, lymphatic drainage and the innervation. This is the structure of ovaries. In both the male and the female, the gonads develop within the mesonephric ridge and descend through the abdomen. However, unlike the testes, the ovaries drop in the pelvis. The ovaries are the paired oval organ attached to the posterior surface of the broad ligament of the uterus by the mesovarium, a fold of the peritoneum, continuous with the outer surface of the ovary. Neurovasculature structures enter the ileum of the ovary via the mesovarium. The main function of the ovaries are to produce the oocyte, that is the female gametes, in preparation for the fertilization, to produce the sex steroid hormones, estrogen and the progesterone in response to the pituitary gonadotropin, that is LH and FSH. Components of the ovary. The ovary has three main histological features. One is surface. They are formed by the simple cuboidal epithelium known as the germinal epithelium. Underlying this layer is a dense connective tissue capsule, cortex. This is composed of connective tissue, stoma and the numerous ovarian follicle. Each follicle contains an oocyte that is surrounded by the single layer of the follicular cells. Medulla. This is formed by the loose connective tissue and a rich vascular structure network which enters via the ileum of the ovary. Medulla. This contains a neurovascular structure. Cortex. This contains the ovarian follicles. The ileum, the next one, which has the cuboidal epithelium at the surface, next to the surface. Clinical relevance. Disorders of the ovary. Ovarian cyst. These are fluid-filled masses that may develop in the ovary. They are most commonly derived from the ovarian follicles, reaching approximately 2 to 2.5 cm. Most ovarian cysts are the benign and develop during the women's childbearing years. However, some larger cysts may cause a problem such as bleeding and pain and require the surgical removal. Polycystic ovary. They are characterized by the hormone dysfunction and the multiple ovarian cysts. It is associated with the infertility. Ovarian tumors. They are another serious disorder. The most common cancers arise from the epithelial components of the germ cell. 90% of the ovarian cancers are derived from the epithelium. These are termed ovarian adenocarcinoma. Most germ layers, cell tumors or the teratomas, which comprise the cells from all the three germ cell layers and are usually benign one. This is the ultrasound image of the polycystic ovary. Ligaments. Two peritoneal ligaments attached to the ovary. Suspensory ligament of the ovary. Fold of peritoneum extending from the mesovarium to the pelvic wall. This contains a neurovascular structure. Ligament of the ovary extends from the ovary to the fundus of the uterus. It then continues from the uterus to the connective tissue of the labia major as a round ligament of the uterus. This is the major ligaments of the ovary, broad ligament and the suspensory ligament of ovary. Neurovascular supply. The main arterial supply to the ovary is via the paired ovarian artery. This arises directly from the abdominal aorta, inferior renal artery. There is also the contribution from the uterine artery. Venous drainage. This is achieved by the paired ovarian venous. The left ovarian vein drains into the left renal vein and the right ovarian vein directly drains into the inferior vena cava. The ovaries receives the sympathetic and the parasympathetic innervation from the ovarian and the uterine plexus respectively. The nerves reach the ovary via the suspensory ligament of the ovary to enter the ovary at the ileum. Posterior view of the arterial supply to the female reproductive tract. Here we can see the ovarian artery, uterine artery, internal iliac artery and the vaginal arteries. Lymphatic supply. The lymph from the ovaries drains into the para-aortic nodes. Thank you.